Hello, I'm Dr. Rohini. Today I'm going to talk to you about the scheduling of IVF up to the point of egg pickup. So I'm going to talk about this today because a lot of patients don't know how long it takes for an IVF cycle to happen, when they can plan their next trip or work schedule, everything. So basically, when we plan an IVF, first scan would be on second or third day of the cycle, and on that day, considering your scan goes well, everything is good, we will give you injections. Ideally, usually injections are given for a period of 10 to 11 days continuously, but again it may vary depending on patient's prognosis. So the first scan would be done on second day. Then either after 4 to 5 days of injections, we will call patient again for a repeat scan to see how well the follicles are growing. Usually on the 5th and 6th day of stimulation, we also call the husband at that day to give a semen sample for freezing. Usually fresh sample is used for doing the procedure ICSI, where the sperm is directly inserted inside the egg to make a baby or embryo. But we also collect a backup semen sample just in case if on the day of pickup the fresh sample is not good, then we can use this one. So on the 5th day of stimulation, we do a scan, and if everything goes well, we continue the same dose. Or if the response is not great, then we increase the dosage of hormone injections, and then we call the patient again on 9th or 10th day of stimulation. So again on 9th, usually 70% of our patients, what we have seen, are ready for egg pickup on 9th or 10th day of injection. It may vary. Maybe if the response is not great, it may go up to 12th day of injection. So scan would be done on second day, 5th or 6th day of stimulation, and again 9th and 10th day of stimulation for most of the patients. And when everything is ready, we would give trigger injection, and then we would plan egg pickup after 35 hours. So when we are planning egg pickup, it will consist of first 15 days of any month. Suppose if you are going to go for a fresh transfer, then it would be done subsequently in 3 to 5 days after the egg pickup, or else frozen embryo transfer is done in the subsequent cycle. Again, scheduled for frozen embryo transfer. So again, patient has to come on second day of her periods, and that day we'll do scan and we'll see if the endometrium is good. Then we'll start her on hormone replacement therapy, HRT. So we'll start her on estrogen tablets, and then we would again call her on 10th day of her cycle to see if the lining is growing well. If it's not growing well, maybe we'll increase the dosage, call her again after 2 days. So first scan is on second day, then the next on 10th day, then once in every 2 days till we feel that the endometrium is looking good. So usually frozen embryo transfer falls between day 15 to day 20 of a woman's menstrual cycle. So this is the usual schedule that we follow for all patients undergoing IVF.